And we'll shut off our cell phones. Thank you.
I muted mine.
I did too, that's still, the switch how to show me how to actually go beyond the mute. I didn't never knew that. I thought when you muted it, you muted it. Are we all set? Okay, family ready. Are we on? Thanks for coming, everyone, on this beautiful night. I know it's really nice out, and it's actually light till 7, which is great. Thank you all for coming. We have a newer member on our team that all of you may not know because everyone's working all the time, and that is Marilyn. She's sitting on the far right. She's a very sweet, wonderful person, and she's been working for us a lot. We were introduced to Marilyn because her mother was on option services, and then things had changed there, and we took Marilyn on, and she's working for us. She's really great. So welcome, Marilyn, everyone. It's Denise next to you if you haven't met her, and Audrey, and Irina, and Maria, and Elizabeth. Okay, as you're probably well aware, there's a lot of changes that have been happening very, very quickly in the home care business in general. This is just one of them. But one of the major changes is the Community Health Choices, otherwise known as CHC. Have any of your clients asked you about this or were confused by this? Have your waiver clients asked you about what's going on with all this?
No.
Because there have been some. I was just wondering if anyone in the room had that experience. But it really has changed things. The Waiver Program, which we have exclusively done in the past and now we do a little less of, started in Montgomery County about 25 years ago or so, and we were the first agency that was involved with that. And Montgomery County Aging and Adult Services was our only service coordinator. We got all of our cases from that. A lot of changes in waiver, a lot of rate cuts, as you know, because we got cut as well, but so did the service coordination entities. They backed out last summer. So it created chaos because they did 99% of the waiver cases in Montgomery County. And it's been disseminated to like 90 different service coordination entities, and some of them not so great. So there's been a lot of confusion, and in the midst of that, in August and September, all the patients had to pick Community Health Choices. So they had to pick all the waivers. Yeah, so it's created a lot of craziness. Well, a lot of the consumers didn't know either, which is unfortunate. So they automatically enrolled them, so at least they did that, but they really didn't have a choice. I mean, it's called Community Health Choices. So it's a lot of information that a lot of people don't understand, so I'm going to try to get like a brief overview. So the purpose of Community Health Choices was to make care more accessible to waiver people, because, you know, the aging population is growing. People are living longer, and the baby boom generation, which I was on the tail end of, the people that were born in after World War II and in the 50s, are now older. They were the first college people and the hippies and everything like that, but now they're in their 60s and 70s, even in their low 80s, and so they're the new aging population. They're smarter and they're living a lot longer, and so the state has this burden of providing care for all these people. And that's where the waivers originate from. So the Department of Human Services is what's at the state, that all in the Office of Long-Term Living always designated the waivers, and they gave it to the AAAs, the Montgomery County Aging and Adult Services, the Bucks County, but all that's changed. So now they're responsible for purchasing health care for more than 2.3 million people in Pennsylvania, and providing medical assistance providers to provide that care. So it was kind of getting messy, so what they did was decided to hand it over to insurance companies. That's what MCOs are, they're managed care organizations. So they are the people who are responsible for the billing with us now. They do all of our compliances, which means 3 extra audits than we had before, so it's a lot more work. And they are responsible for all the care for these clients. Their physical, their mental, any of their needs. So they have to get them doctors. We're finding some of our patients didn't realize when they went on Keystone that their doctors don't take that, so they can't go to their doctor. It's been very sticky. But there are 3 major insurance companies in this part of the state that are doing it. It's Keystone first, which is called AmeriHealth everywhere else, but it's Keystone, which is one of the largest in this area. UPMC, which is a big name in Western Pennsylvania.
I wondered what it was, I keep getting the letters.
Yeah, it's confusing.
Yeah, it's like.
And they have two names.
I have nothing to do with you guys, what you.
Right, so Keystone is called AmeriHealth, like which is which? Well, in this part of the state, it's called Keystone. And then there's PA Health and Wellness, who is the third MCO, and they are part of Centene. Centene, so people, it's the same organization, but for different parts of the state, for some reason, they're picking different names. So it took us a while to get used to that. We've been going through this for years, actually. It's all here now. So the managed care organizations are responsible for all this care. Our biggest fear was, like most insurance companies, you don't usually get the best care. All they care about is money, right? So the Department of Health and Human Services gives them a per capita per patient. So the insurance companies have to make that work. Some people are more costly. Come in.
Sorry, I'm late.
That's okay. Some patients are more costly than others. You know, so you know that they're gonna trim around and things of that nature, but they say they're committed to better services. We were supposed to be up and running on January 1st with this. No glitches, because they started in the west part of the state last year. And everything was gonna be fine and spotless. Well, we have spent the past January, February, and all of March just trying to get our clients in the system. They're not in the system, we can't bill. So we're still trying to bill for people from January, so it's been a very sticky situation. But they're saying that, you know, this is supposed to make things better. We've yet to see that, but that's what we're all facing. So they are managed care, you know, Pennsylvania managed care program for dually eligible, which means if you're dually eligible, you're Medicare and Medicaid eligible. So that's what the waivers are based on. Come in.
Does it affect any way private clients?
No, because they're not on waiver. These are waiver clients.
I don't know much about it.
For those who just joined us, we just pretty much started. We're talking about Community Health Choices, which is the managed care programs that took over the waiver program. And there's 3 MCOs or insurance companies that are now providing care, and we have to do things according to their rules now. Department of Human Services and Office of Long-Term Living once did the waivers, and they handed it over to Montgomery County Aging Adult Services, Bucks County. It's no longer the case. So it's a whole different world out there, and it will change the way we do things. So, as you can see from one of the handouts, I mean, there's like 420,000 plus people, I think that number's low now, that are eligible for the Community Health Choices population. So this doesn't only include the aging waiver. Individuals will be enrolled in Community Health Choices if they are 21 years or older if they're receiving both Medicare and Medicaid. The only people who are going to be on Medicare when they're that young are people that have been considered currently disabled. Because once you're disabled for 2 years, you're then Medicare eligible. So it's only for the younger people who are clinically nursing home eligible. But that's what the waiver program always was. You know, options, you know, we have our options clients. They're people who are nursing home clinically ineligible. So they were able to qualify for these services, but they weren't able to qualify for the waiver services, which are more hours, because they weren't considered or clinically eligible for a nursing facility. I know it's kind of confusing, but it's what it is. So the aging waiver, of course, is part of this program, and the Community Health Choices covers the same physical health benefits that are a part of Medicaid, the adult benefit package today. So it's pretty much the same, but it's been a shift in who's providing it and who's setting the rates, you know, and so there's a lot of unknowns that will happen with that. I know for people that worked in the convent, there's also this new LIFE program. This is brand new. So the LIFE program is an alternative to the Community Health Choices. They were pushing everybody into Community Health Choices and kind of ignored the LIFE program, which is kind of an interesting program if you live around it, because there's very few of them. They're just starting to sprout up here all of a sudden. It is affecting us as well. but life stands for living independence, or independently for the elderly. And they do the whole thing. They have to provide the physicians, the podiatrists, the PTs. They basically have to provide all the care for the clients that join up for that program. And for some people it works very well, other people aren't very happy with it. We just lost 3 of our major waiver cases because they joined the life program. I believe the life program may help them because they have many more people in that building that are going to be having a lot of health issues, and they may not all be able to get in the waiver program. So, and I'm actually working with the people from St. Mary's Life. They want to contract with me, and I've sent
The
them a
funny part
contract.
is not everybody, the top people didn't want that,
Of
nothing
course
to do
not.
with
I
insurance.
talked to them and I said, you can
Even
always
Sister
switch.
Cecilia, you don't know her, she's old.
Of course.
And
They
they didn't
did.
want none of it.
Dorothy Ann, nobody
Yeah,
knew
she said
it.
that.
So I
So,
educated them on it, and I told them they can switch at any point. This is consumer choice. Person can pick. Unfortunately, some of the clients that went there had no idea. They were not personally making that choice. But they can always switch back.
I will miss her so much.
Well, the whole thing is the waiver program as it's designed, you have to have that one-on-one service. That's why we have you clocking in and all that. The life program's not. It's a team, and they can staff it any way they like, and they're responsible for everything. So yeah, one sister could be sitting there not changed all night long because they left at 3 o'clock.
They don't work holidays, they don't work weekends.
I know.
Past 3 and all
Right.
that, they don't work weekdays
So
past 7.
people, when they're making the
People are not
decision,
happy.
should know that.
Well, I guess I heard that they didn't disclose everything.
Yeah, or research it that thoroughly. And they told me themselves that they have people there to help, and I told them they don't. Yeah, but in any case,
We are the people that do the.
right.
Now we're.
Well, no, you're not to do that.
I know that, but that's not stopping them from. Could you do this?
No,
I know,
it's
baby,
absolutely,
baby.
say no, absolutely not. You're no longer a patient of ours. You know, I can't. I mean, technically, we should not be touching anyone that's not a patient of ours. You know, because there's liability involved there, and also, if they're not a client of ours, you should not be touching them. And you can simply say that. You're not a client of ours, we're not permitted to.
Oh, they know, they was like, even if there's a dog on the ground and you wouldn't try to help the dog.
Well, you chose the life program, so I would come back, you chose the life program, not me. This was your choice. And that's what it is, it's a choice, and I let Dorothy Ann know that very well. I let everyone working in there, I think I talked to all of you. The sisters are saying something, you simply explain that. But to move on, there's all these changes, yes.
Can they change, if they decide that they don't want it, can they change back?
Absolutely. It usually will take about a month, so say if they did it mid-March and they said, oh, I want to switch back now, it would probably be effective May 1st, not April 1st, because it's too close.
Okay.
So a solid month away, so
I think
whatever
they'll
the
be
first.
switching real quick because there is a
Once they
lot of
realize it.
cutbacks in medication. Nurses that work
I heard.
there, they don't know, they cannot
That's crazy.
order what they need.
Well, they really want me
And the way it goes,
to
it
contract
looks
with them, so I'm hoping that we will stay in there in some.
But now they're saying that we
Here.
won't be even able to have as many pull-ups as we needed because the waiver program said it. These are
The
what we
waiver
bring their
program won't.
own.
That's the life program's responsibility to get it for them now.
Yes, and that's the thing, and they will be counting everything.
Yeah, well, this is the way it is now,
That's what they
unfortunately.
wanted.
The state of healthcare is like this now. They were talking about mass numbers of people, even hospitals. You hear all the time how hospital care has declined so much. It's very true.
Yeah.
That's why people pay us to go and sit with them in the hospital when they have a whole team there, but they feel better knowing that they know us, and they feel better that someone's at least sitting with them, and they're not being ignored when they press the button. But that's,
That
you know,
is true.
it's healthcare, it's, you know, needs reform, it's very obvious, but in any case, so that is the community health choices in a nutshell. You can always feel free to ask questions, it is really confusing. It's confusing for the consumers too. They have all kinds of numbers that they can call and reach though. There are provider numbers, there are numbers, but you know, it's hard for people to navigate that. That's one thing the AAA's did, Montgomery County and Bucks County. They help people navigate through the system. As some of you are aware, we have clients on hold because they didn't get their paperwork in. Montgomery County would have kept that going and got that paperwork in, but no one's doing it. So I've spent the last 3 months on the phone, having to waste hours a day saying this patient doesn't have this is not, and that's not the provider's thing, it's not supposed to be that way. And if it doesn't stop, I'll go crazy, but it's just, hopefully, just the way things will work out in the long run, but we have yet to see that. So there's a lot of confusion going on.
Will it affect our personal health insurance in any ways, or?
Well, we're not, our health insurance right now is so unpredictable anyways. But no, because we're not in the waiver, it's not gonna affect it that way. But yeah, every year it's a grab bag of what's gonna happen with our health insurance, as everybody knows. So, I think I covered most of this. People on skilled nursing facilities that are eligible also, what Medicaid pays for while they're in, the CHD will cover that too. So, just so they meet the financial requirements determined by the county assistance office, which is tough now, we have to go through them, we never did. The counties, Montgomery County did all that, now we're going through the Medicaid office, so you know how taxing that can be. Any questions so far? I know it's a lot of material. So it will totally affect the way we do business. So previously, the Department of Human Services paid a per member a rate that's capitated to the MCOs. And it holds the MCOs accountable for quality outcomes, efficiency, and effectiveness. And they're the ones that have to monitor us now too, on top of them. So it's much more paperwork and audit work for us, which is tough because we are a skeletal crew and nonprofit. So we're working really hard in the office too. So the MCO coordinates and manages physical health and long-term services for participants, like if they need transportation, or if they need, wipes, or if they need, diapers. It works with Medicare and behavioral health to ensure coordinated care. So that was the purpose, was a lot of people were caught in snags, like how do you coordinate this care? This supposedly is supposed to do that. We haven't seen it yet, but it's definitely what was in mind. And they were really interested in developing a robust amount of providers so they can make sure that people will do it, because this isn't for everybody. A lot of providers are like, no, we're not doing waiver anymore. And we've thought about it, but right now we're still doing it. So the providers contract with the Commonwealth. That used to be the case. Now, we have to contract with the MCOs, and we have to bill the MCOs for our services. Yes?
Do you have any idea how the services will look like if there's a live program, whatever, when they contract with us for convent?
What do you mean?
Well, how would it work? Will we?
Oh, so this is kind of interesting. So if it in fact happens, because I know these programs and contracts, because the one in Norristown, whom we actually know, very nice people. Mercy Health is the biggest healthcare system in Pennsylvania, which I didn't know. They started that life program. St. Mary's is just a little subsidiary of that. They will probably try to get very little hours from us because they have to fit it in their budget. But at least I think it's a way for us to stay in there, you know what I'm saying? And I think they will need our help, and she seems very anxious. The executive director is actually very nice, and she seems very anxious to keep us. But it's not her decision in the end, but we have been communicating. I always try to leave all our options open. And it would basically be like a private pay thing. So you would actually go in and punch it under the life program, not specific sisters. And you would be, if it was 2 hours they contract, you'd be there for 2 hours. So it's not your responsibility if one sister per sister, like in the waiver program and community health choices, it's that one-on-one care. They're requiring, we always had electronic visit verification and care watch. They're requiring every organization to do that now. A lot of providers aren't really up to doing that either, so it's going to be an interesting year. So the six-month roll-up period was from January 1st through June. So after that, anything can happen. They can change the rates, service coordination entities can be dropped, providers can be dropped, but I'm not worried about that right now.
Because the way the lady works there, well, I was there almost 2 weekends ago, my every other weekend thing. And she's always in the books, she has to document everything in a paper on the
Yeah.
phone.
Because she don't have a,
They don't have that system
yeah,
yet.
she don't have that system, so she have to write it out.
Yeah, and not only that, they have to bill Medicare. So it's different, because we don't bill Medicare. See, Waivers Medicaid, but they are responsible for the Medicare portion as well. And we are talking about going home health in the next year or so, because it seems to be what we will need to do. Because the rates for the non-skilled home care has just been so bagged, and home health is still quite profitable. It's a whole different lot of paperwork for us, and we are considering doing that in the upcoming year or so, because that will give us more range and more options, so we're always looking to do that. So how this affects us and what we do is that we are being audited and stringent to very strict things. We always were, the counties have been really that way, but the waiver program never was. I mean, the QMET team used to run the waiver program. They're supposed to monitor people every 3 years. We've been doing it for over 20 and they never came till this year. So they weren't monitoring very closely and they really don't have the absolute picture. But we did well.
Good.
Well, what I'm finding is they're really meticulous about every little fine-tuned thing. And the Department of Health, which is our state licensing, we've never had a problem. They've only hardly come out because we're so good. But they're coming out this year and they are, warning us that they're looking at every duration and frequency, which means if your shift is 2 to 5 and you're coming in and you're cutting that by half an hour, we're in trouble. We have to document it. And the problem we're having is that if there is a situation where such and such and you report it to the office, we document it and we have that documentation and we notify the consumer, it's okay. But when people don't call us, and this happens frequently, and they make their own schedule, we are going to be in we're going to be cited. And this is just something that we're not accustomed to having done because we run a really tight ship and we follow best practices here. We take it very seriously, as you know. The people we work with and the nurses and the schedulers too are all very committed to, giving state-of-the-art care. We've always been a very high-touch organization. Most aren't anymore. Things have gotten just, like warehouse kind of care, and we're not like that. We still want to stay the way we are as far as delivering care. So in order for us to do this and stay contemporary with the demands, we really have to ask everybody, and that's why everyone's going to be seeing this tape, you have to punch in correctly and follow your schedule. If there's any alterations, you must call so we can document. So this, we had a complaint, and we rarely seldomly have that. And it was from a very difficult client that we had 3 times a day. That was, the son was a little nuts. But it doesn't matter when the state gets a complaint. He was articulate because he's a little obsessive. He wrote pages and pages and pages. So they came a little skeptical. And unfortunately, I had the documentation of my conversation with him and what was there. So it was, they were saying an accusation of theft, but there wasn't. He simply called me and said, 7 weeks after his mother died, do you need to ask the people who worked here if they saw a calling card yet?
No.
And I did. And everyone I know very well this is the case, and they're like, no. And most of them never even used it, only one did, and I know her very well, and she was nothing but helpful. And so then he went on to the state and complained at that, but had I not had that documentation, and she said, why didn't you report that to the state? Because remember critical incidences, we'll get into that. And I said, well, he didn't accuse. He simply said, I'm not accusing anybody, I asked. But if not for that documentation. But he also complained about missing shifts. People didn't come, or he had details of how long they stayed, blah, 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 blah. So they had to investigate. Well, I showed her through all of our electronic visits, there were no missed shifts.
Yep.
But one day, and this happens, there was a call out. So we didn't miss a shift though. We got someone there at least for an hour or so. It may not have been the full time. So we did our best. But we almost got cited because we didn't have any documentation of why that happened. Like it should have been documented. There was a call out. We made sure we got each shift covered and that the consumer was notified. So it just takes that extra step. So when someone says, oh, they're not going to bother calling the office, it's bad.
It sounds like something Sam Album would do.
Yeah, remember that.
I remember
That was your
boot
welcome
camp.
into the agency, wasn't it?
Oh, I remember that.
So that's talking about the consumer complaints. So this is required that we go over these things. The consumer complaint procedure, they can make a complaint at any time. So they should let the nurse know, but they can let me know, and then we have to go and get their description of it. We have to ask the aide or persons involved what their version is, and we're really fair about that. I really defend my people because I know we have excellent people. No one has an agency that has people 20, 25, 30 years like we do. They're like, what? You mean the state was like, what? They'd bring down the files as they're auditing, and they look through every page, and they're like, oh my God. I'm like, well, yeah, because they're used to seeing charts as big as people last 3-6 months, So they said on a couple of the charts, well, they don't have a criminal background check. I said, they certainly do, but in 1991, when they were hired, it was a police report. So they didn't even know that, so I'm educating them. But so it's a very tough world out there. I mean, they're looking at every little thing. So I can't, encourage everyone to please, those policies are in place for a reason because they protect us and they protect you. If I'm calling you to question you about something that somebody said that's totally untrue, it's a good thing I'm questioning because I can document exactly who you are and what you said, and I can defend that. And then we also have to make sure that they are part of the resolution. Was the customer satisfied? And did we work towards a resolution? So did we do something at least that made them happy with what we did? And they're really enforcing this now, which they didn't do so much before. And that goes into our quality management plan. So every customer we have in their discharge, and the nurses go out every 3 months and they question them, and we have a 1 to 5 scale. What do you feel about our services? Are you satisfied with our services? We also send people surveys, detailed things. Were your aides reliable, punctual, friendly? Was your nursing supervisor informative? What was your opinion of the services? And I have to tell you, our results are stunning. I mean, they're really good. We're only getting like 55% back, but you know, it's hard with people with some die and you don't know. But yeah, I'd like to get more because this is good for us. We can promote our business that way, but the responses have been very, very good. So we are required by the Office of Long-Term Living, the Department of Human Services from the state, the Department of Health from Pennsylvania, Bucks County, AAA, Montgomery County, AAA, and now all 3 MCOs to do this. So we have to have a quality management plan. So right now that is to make sure that the services we provide are excellent and the customers with their needs and satisfied are met. So we're measuring that right now. We also have to start measuring now because of this little problem we're having with duration and frequency, which means that if it says 3 times a week, we have to be there 3 times a week and on those days. And the duration is how long we're supposed to be there. And we do have people cutting shifts like that. You know, they just leave early, they don't call us, and you know, we must be notified so we can document it. So that's what I mean. When we think that, oh, it's only 15 minutes, they picked up those 15 minutes. It was really surprising. I'm like, really 15 minutes? Because I do fight back for us. I'll go and show them. And she said, you don't have any criminal justice. I said, oh yes we do. You don't know what they look like. Here they are. I'm not afraid to, you know, but you want to be diplomatic, but you know, it's crazy. It really is. So please, if you have to leave early or something, like, let us know. You know, because that's, for us to have that gap and that electronic visit verification to care watch things, they've studied that.
Sometimes it's not like leaving early, sometimes they're on the phone,
Oh, I know.
and we can't clock out.
Right.
Yeah.
That's a good point, Charmaine.
Call.
Yeah, exactly, you do. That's just what some people don't. They let us know 3 days later. And then that's bad because then we have these slats where time should be. And the lady from the Department of Health knows that. That's a red flag. There was actually a care watch issue that day. But if that happens and you can't punch out or can't punch in, that's fine. Call the office and say, I'm here, but she's on the phone. And if it's somebody that has a habit of doing this, we may say, okay, we're supposed to ask for the client so we can verify that. So this is just best practice. Don't take it personally if the scheduler ever does that. This is just how we have to cover ourselves, or we're just facing a lot more penalties. And we don't want to be fined, and we don't want to be cited, because then it'll be back and back and back and back. It creates a lot more work. And we love our reputation. You know, our reputation's super.
And sometimes we didn't pay his bill, so we can't clock in.
Right.
I know, a couple of times.
And we have it happen a lot. It's
Yeah.
just you always let us
Sam,
know.
to that point, should we document something like that if a client has just a cell and their bill is?
No, it's the house phone.
No, I'm saying,
You know what we can do, Kim?
We did
So
have a
we can
client
put
who
both.
used their cell phones to
Yeah, we
call.
have some clients who don't have landlines in there,
Yeah.
especially in Northside.
right.
We have their cell phones in there. And so we've had a problem with one client in Norristown, because Norristown clients are different than here, but where we told them that, okay, have your cell phone, let the aide just use that, baby on it, so they would have to call us on her cell phone. And we can do that, and we should verify it with him. But I know one aide said that, oh, I just couldn't clock in, she never let us know. I said, well, why didn't you? So I called the gentleman, he wasn't even home. So that's what I mean about fraud. We have to be very careful about this, because they
How
can
about
say
when
this
we
fraud.
overstay a few minutes, like how that works?
That's fine,
Will you
like,
get
so
paid
if
for
you
it
got
to
there
come
10
in?
minutes late, per se, this is waiver again, or auctions for that matter. If you're 10 minutes late, you really should stay the extra 10
Usually
minutes.
don't happen.
We don't bill for it, like, you know what I mean, we're not allowed to bill past what they've authorized. So if they only authorize 3 hours, But if it's an emergency situation or something like that, you let us know,
Oh, I see.
we will contact them and say this was something where it was a client, and they're usually pretty good. I don't know how the MCOs will be about that we could do that with the county because of our relationship with them. But we'll see, but generally, if there's an emergency situation like that, let us know. We will try to, document that it was a necessity. We have such a good relationship with Montgomery County Aging Adult Services, it was never a problem. I would call the supervisors there and things like that. There'd be no problem saying if my documentation was on, I'd send them an email, follow up, blah, 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 blah.
What if you already clock out and they wanna go on a party?
I know that's a problem. This is something that we've had a big problem. People, you tend to know the people that do that. You tend to say, you need to let them know, I need to leave in a half an hour, you have to go to the bathroom.
They do
Do
it
no.
on purpose, yeah. Do it on
They
purpose.
say no.
what you can,
Yeah.
but you have to let them know you have another client, you can't
Yeah,
stay
it was
here.
like, I asked you like half an hour, you was like, no, I'm not ready yet.
And this is this human kind of
Yes.
flexibility we always had in this agency that we're not permitted to have so much anymore. Like I said with Montgomery County, I could document that if you called and told me not a week later and say she had an emergency situation, and that we had to tend to her. She messed all over the place and it was time for us to leave and we had to stay an extra 15 minutes or something. Then they would be like, fine. So options, I can still kind of do that, but with this MCOs, it's impossible to get a hold of them.
That's the thing, that will be a big mess.
And we're supposed to call the service coordination entities, and they don't know anything, because we're in this 6-month period where no one's communicating with one another, so it's been really tough. Yes, Elizabeth?
And it happened a few times that when our clients are just not stable. And usually there is somebody in the home, and that was a day my client was just all over the place. She almost fell on me in the bathroom.
I remember.
Nobody was home. It was time for me to go, and it took me another 20 minutes. I wanted to make sure she was down the
You
stairs.
did the right thing.
I was with her in the kitchen, and I was constantly next to her and holding on to her. She was unstable that day, and that comes and goes.
I know who you're talking about, and that's an
I
option, that's an
don't
option
leave.
tonight, correct?
I don't leave.
No, you shouldn't.
Well, I clocked out.
Yeah, but let us know. You can if you want, if you know something.
I
wrong.
clocked out,
But let us know.
I could not leave her.
Right, but you can call us and say, I can't leave her, so we could document that. What they might
I
make us
had to be
do,
behind her.
I know that client. So say they had 6 hours a week for options, at least we can tell them that. And they may not grant us that extra time. Sometimes they will, but right now, things are tight with the money that's going to them. We're not getting new options cases right now. We're not getting new waiver cases right now because of all the chaos. It's a little scary. And we're losing some to the light program. So the thing there is that we can do that and document it. They may say, well, then give her 20 minutes less another day. So, I mean, this is the way it is in healthcare right now, unfortunately. But the important thing is that it's just aware that any situation like that, of course, we're not going to leave the client like that. We're not an agency that would do that, though many would because of the red tape you have to go through to help somebody anymore.
Yeah.
But we'll get through this. I mean, it's like anything that's transitional. We will somehow make this work. So be aware of the complaint procedure, because any nut can make one, whether it's legitimate or not. So we just have to really follow up with that, and don't be threatened at all if you're called and stuff like that, because I'm an extremely fair guy, and I'm always,
I'm kind of confused, is the state trying to phase out the waiver program completely?
the
or-
waiver program is still the waiver program, but it's no longer being delivered by the Department of Human Services in Pennsylvania. They've handed it over to the
Somebody
MCOs,
else.
but they have a choice. You pick the MCOs, community health choices, and that's all anything new. No one knew about the SLIDE programs, there was very few. It's only available in areas that had life programs, and there's very few that do. They've just sprouted up here in Montgomery and Bucks County now, and they're kind of taken off. So those people didn't know what the life program was. If you go on the website, you'll see all the stuff about CHC, you know what they're talking about. State websites just go on and on and on. It's like scripture. But then the life program is one little page, but it's going to be definitely increasing. So it's not waiver though. The life program is a totally different program, but it is for what were once waiver clients. You either choose waiver or you choose life. And of course, the majority, 5,000 in Pennsylvania are community health choices right now. So the life program is still a very small alternative, but I think we'll see it grow, and it's already affecting our business. So there's so so many factors that affect our business on a daily basis. And a critical incident thing, we went over this before, but if there's an incident of any kind, we have to be notified, you know, immediately, so we can do the follow-up. And critical incidences are, you know, something where there's abuse and neglect in the house, something where they fell and they really need to be hospitalized when you were with them, whether it was your fault or not, doesn't matter. We have to report any change in status, a life-changing kind of status event. So it's abuse, neglect, falls, anything like that. And we've had people not report it, and it's like, that is really big trouble for us, because if something is reported somewhere else, we are then held negligent. And they're now including in critical incidences theft. So this is what I told the lady, this wasn't even an accusation of theft. First of all, the participant died 7 weeks prior to him calling me. So how do I even enter that into the system? The person's not living anymore. She didn't know. But it's a good point. She said, yeah, I would do if someone does that in the future. Go into the system and say, someone called and made, you know, and what you did about it. So we have to do this for everything now. So that, I guess, because there's such a problem, we don't have that in our agency, fortunately, so we have great people that work for us. But it is a rampant thing, and fraud's very big. In Philadelphia, I mean, aging waiver in Montgomery County is like 800 people. It's like, you know, 100,000 in Philadelphia. And there's been a lot of fraud going on there, and agencies that just use paper and aren't supervised. So they're going to be cleaning all of that up, and it's going to affect people's hours. They're going to start cutting people's hours that had these big blocks of time and had 6 family members there that could have helped them.
Had help.
We didn't have that privilege, because Montgomery County Aging Adult Services are very strict. No 2 here, 2 there, so they did it the right way, and I have a feeling the MCOs are going to do that. So I'm glad we weren't used. They had a little heyday in Philadelphia grabbing all those hours, but it's all going to be changing. So hopefully that situation will be cleaned up, and we never did that, so we're fine and good. We look sweet. But the critical incidents thing is very important. We have to go onto a website, onto the state, and to the MCOs as well, and report this. And if we don't, we're cited, and we could, you know, lose our license. So it's extremely important. But even little incidences, it's important that you come in the office and you don't report to everyone's probably had to do by now. Just so we have the documentation, is really, you know, what saves us at the end of the day. And we just have to get better. It's the punching in and punching out that we're having the biggest problem.
That's what I had a question about, with my client, and it happened in a convent too, we lost the power.
Okay.
I have to use my cell phone.
Right.
Would that affect you in any ways? And sometimes I clock out, it will let me do it, but clock in, I can't do it.
Just call the office. You do usually. I mean, when something like that happens, call the office and say, just power outage, I can't clock in. We know who you are, we're not
Because
gonna
I
rush.
know it happened in the summertime, we left them all
Yeah,
downstairs in the dining room.
we get daily we get so many crazy things, but the thing is, if all these things happen several times a day just because we're serving so many people and so many hours of service, they can easily build up and get behind you. Someone doesn't let us know we're doing payroll, we're like, yeah, you have 5 punches you can put in, and they're holding up payroll. We're like, you're not gonna get paid, but they have to go back in and do those visits, and that's fraudulent. You're supposed to let us know at the time so we can put in the accurate thing. So, you know, people like that come in and get disciplined because it's not, it's
So
laziness.
I usually try my cell phone first, and then if it don't work, I call Bonnie or
Exactly,
whoever,
you
don't
always do
call.
that.
I have a problem on my phone. I always say, no, I'm not clocking on my, even when I talked to Bonnie, she said, you can use, I was like, no, I'm
Yeah,
not using my cell
yeah, it's the
phone.
best rule, because if you start opening up boxes, sometimes you're letting in.
No, I don't like that,
So
I like
much
to
more.
use the client's
Yeah,
phone,
that's what
but
I'm saying.
sometimes.
Well, we covered a lot, surprisingly, in this period of time. So please follow your schedules, everyone, and you know, it's really become a big thing. Last time we discussed the HIPAA issue because we were having a lot of people talking about personal things to clients and all. Since we addressed that, it's kind of gotten better, but always remember that. If a client's badgering you about another aide that comes in the house and all, don't go there. Just say, you know what, I'm here to help you, let's talk about you or something else, you know. Or simply say, I'm not permitted, that's HIPAA, I'm not permitted to talk about that person or another client. You're not permitted, it's a violation.
I'm just kind of smiling because they're nuns in a convent. I don't like them, I don't want them,
Of
I want
course.
you bags, other than
Always do
that.
that. Does everybody understand the quality management thing, how we're responsible for that, how we have to measure our credibility and how we have to measure what we're doing and if we're fulfilling the needs of people, because that's something that's very big right now. And to do that, we have to question people, so they can write anything. So remember, if there's something new, some people that, not no one in this room, but some people that don't care and don't bother to follow the rules, that shows on those. And you know, that's not good for us, I mean, because we have to do this.
I don't follow the rules.
You think you're good, you're good.
It's easier to play by the book.
Exactly. It just creates more problems, and it protects you as well as us. Yes, Claudia?
Yeah, can I make a comment about the plans of care? Because remember,
Yes.
ladies, I give out notebooks, brand new notebooks, where I want you to have an actual copy of every one of your patients. Because remember, if you go in and they're on the floor, they fall, you have to press medical alert, you need to give that copy to the police, to the EMTs. That way, all the pertinent information is on their sheet, so that the police or the intake nurse at the hospital is able to contact someone properly. You need to always call the office, and then Sheila, Bonnie, they'll contact the family. Because you need to stay with the patient till the EMTs come, till you know that patient is safely out, and then communicate back to us. What both Kimberly and I need is for you, when you're hearing things about another patient or anything else, is something you need to report about what's happening at home, let us know. The plan of care says who the nursing supervisor is, and it's so helpful for us. Because you know, like today when I was with Elizabeth's patient, I only see them 4 times a year. Maybe I make an extra one here or there unannounced to see one of you on my team, but otherwise, you're my eyes and ears. You're my observations, and I really appreciate knowing ahead of time. It prevents a lot of other problems. I will change the plan of care. If you see that something isn't working, again, let us know. Because both Kimberly and I, we have to sign every single one of those detail reports when the billing is confirmed.
Exactly.
So we don't want to be signing something that's inaccurate.
And Claudia's right, I mean, it's the reporting that's so important. And that's another, she brought up an interesting point too, because some people need to go, you call the EMTs and they have to go to the hospital and they want you to come.
Yes.
Unfortunately, in
How about
waiver,
with the private client, if your family
Exactly.
member asks to
exactly.
go,
So
and you
waiver
go.
and options, we're not permitted. Waiver is like, we'll only do that while we're in the home. They will not, once that client's out of the home, we're not. It's a shame, because sometimes they didn't have anybody.
Yes.
We've had people
We
of their
have
own good nature and goodwill to actually do that. Private pay clients, you can if they want you to. Because private pay, they're paying for it. So if they say, could you please come? And you can. You can't say I'm not allowed, you can call us, but if the private pay client wants us to do that, that's fine, you know, because there's not those contractual obligations that have become so stringent with waiver options, the 3 MCOs, Department of Health and Human Services, Department of Health. I mean, there's a lot, so, you know, and that's best practices, and that's what we follow. So we're up against that. The plan of care thing is also important because it is true, it can make you uncomfortable. We had EMTs rush in and they went up to one of our direct care workers who's very experienced, been with us many years. And they said, asked her all these questions, and she didn't know, and she said, they made me feel stupid. She came in really angry at me and said, you know, I said, well, did you have your plan of care? Because all you had to do is hand it to them, then we can give you another copy, you know? But she said, well, isn't there one supposed to be in the home? We always give a copy to the client, but we don't know, sometimes they misplaced it, or the daughter put it somewhere. So you can't count on that, but they have one, because it's not like we don't. We want them to have that always, because they are a part of making that plan of care, and that's the law too. So it's a lot of us that they are involved in the plan of care and involved in decision-making of their care. So that is a state law as well. We do all these things. This is what we do in this end. So for you, it's just to be the perfect, sweet, wonderful people you are, and to report to us any challenges and changes, you know, because that is, but we couldn't be more pleased with our staff. We have a wonderful staff of people, and everyone in this room does such a great job, and we really appreciate it. Any other questions before we wrap up? Hi, Julie.
Hi,
Good to see you.
thank you.
Keep up the good work.
Everything, yeah. If you have any questions about community health choices, please feel free to call me. I don't know if I can answer everything, but I'm kind of living it, so Great, anything to add?
Did everybody have a chance to put their name in